Dear doctors, hope you are fine. Today, Dr.MedExedu Indian Medical Society is going to start MCQ session based on dermatology. Hope you people will get a lot of advantage from this session. Dermatology. Yeah, let's begin. Question number 1. Question number 1. Image given in the question indicates which sign? This indicates which sign? Yes, please tell me. The image given in question indicates which sign? Yeah, option A, hospit sign. Option B, dermographism. Option C, Kovner phenomena. Option D, Nikolsky sign. Yeah, please tell me. Yeah, yes. What? Pardon? Pardon? A? No. Not A. Hospit sign. No, it's not possible. Yeah. So option is C. That is Kovner phenomena. Kovner phenomena. Why Kovner phenomena? Kovner phenomena involves new skin. Kovner phenomena involves new skin. Okay. Kovner phenomena involves new skin. Okay. New skin lesions appearing at sites of trauma in patients with certain dermatomes. It is also known as Kovner phenomena and isomorphic response. So option, which option? Option C is the answer. Okay. Option C is the answer. Okay. Come to the question second. Yes. Very good question. Very easy question, I hope. Before the question, you try to pay your attention on the nail. Nail, base of the nail. Okay. Try to pay your attention here. See the question, the nail of this person. Question second. The nail finding. Okay. That is the characteristic feature of psoriasis vulgaris. The characteristic nail finding in the given image is. So what do you think about this? Yes, please tell me the answer. Option A, subungual keratosis. B, hospit sign. C, oil drop sign. And D, onycholysis. Okay. What will be the option? Option A, subungual keratosis. Why? Subungual hyperkeratosis refer to the accumulation of scales under the nail plate, which is detached and uplifted. The nail bed often appears thickened. The condition results from excessive proliferation of keratinocytes and failure to shed off from the stratum corneum. So, what and how this happens, we are coming to the point. Answer is A. Okay, we are coming to the point for this. The poison. This is a mnemonic. This is not any word. This is a mnemonic for nail finding in psoriasis. Okay, so yes is correct and widely used. So pitting, mnemonic is going to be pitting, wild drop, subungual hyperkeratosis, onycholysis, and nail plate dystrophy. Okay. So they are telling to remember first letter, that is P, O, I, oil drop sign, subungual, okay, subungual hyperkeratosis, onycholysis, O, onycholysis, okay, onycholysis, and N. That is P Letter P, pitting. Irregular pits from the matrix damage, most common. Oil drop sign, salmon patch or oil spot, pathognomic yellow red nail bed discoloration, subungual hyperkeratosis, thick white debris under the nail bed involvement, onycholysis, nail plate detachment, often with erythematous border, nail plate dystrophy, crumbling, ridging, and thickening. So this is few important points about the subungual keratosis. Okay, come to the symptoms. What is the symptoms for this? Symptoms. First symptom is that. Let me start. First symptom is that nail thickening. Nail thickening. Next, tenderness. Tenderness. Okay, especially toes in shoes. Especially toes in shoes. Okay. Another point. Possible blood spotting. Possible blood spotting. Okay. Often with onycholysis. Often with onycholysis. Okay. Come to the question number 3. Question number 3. Okay, question number 3. It's a very easy question. It might be possible you know the answer and you will tell the answer of this question. Yes. Third question, identify the disease given in the image. See the nose and all the areas here. See how it looks. Focus on face. Okay. So what is the answer? First is Leishmania cutanea. I don't think so. B is lepromatous leprosy. We can think about it. Read the option. Continue. Post Kalajar dermatitis. Don't think so. Tuberculoid leprosy. Oh, I think it's lepromatous leprosy. Yes, you are right. Lepromatous leprosy. Option B is correct. Okay. So there is another very important point. I hope you people know it. This question we are going to most severe multibacillary form of leprosy dash caused by the high loads of dash. Okay, what is this? Lepromatous leprosy. Lepromatous leprosy is the most severe multibacillary form of leprosy that is also known as Hansen disease. Okay, caused by high loads of what is the causative agent? Mycobacterium leprae. Bacterium leprae. Okay. Lepromatous leprosy is the most severe multibacillary form of leprosy and also known as Hansen's disease, caused by high loads of Mycobacterium leprae. Come to the question number 4. Okay. Come to the question number 4. Question number 4. Question number 4. What is the diagnosis of this? Okay. First of all, see. First of all, you can see this question. Where is the mark? What is the diagnosis of this patient? Yes. Please see the image based study, and then first of all you have to find out the diagnosis, then only you can give the treatment. Otherwise you can't give the treatment without knowing the diagnosis. So diagnosis is first. So what is the diagnosis? Diagnosis is herpes zoster. Diagnosis is herpes, HERPES, herpes zoster, herpes zoster. Also called, also we can say this, herpes zoster, herpes zoster. Also another name is SHIGLE, shingles. Okay, shingles. Okay, so you can shingles or shingles, whatever you want to say, you can say. This patient is requesting you to give him medication. Which drug you will prescribe to this patient as a physician? Yes, please tell me. Which drug? Valacyclovir, imipenem, carbapenem, and penicillin. Okay. Which drug? Please think about it. Which drug you can give to this patient? Acyclovir? No, it's not in the option, but you are right. Acyclovir, we can give acyclovir. But here option is valacyclovir. Acyclovir, yeah, that also can be given. Acyclovir also can be given. Explanation, okay? Explanation of this question. We can see from the image that the lesion has a clear midline demarcation. Okay, the image has clear midline demarcation. See, clear image has how its demarcation. See, okay, midline demarcation, and a vesicular lesion on the erythematous base, leading us to the diagnosis of herpes zoster. Okay, we are sure that this is herpes zoster, and the treatment is acyclovir or valacyclovir. Okay, it is a reinfection of the varicella virus. Also, this condition is painful. No? Also, this condition is painful. Okay, this condition is painful. Appears as a vesicular lesion on the erythematous base on the dermatomal distribution. Come to the question number 5. Okay. Yes, lepromatous is okay. Yes, this question is also a little bit, you can tell me some information regarding it. This herpes zoster, this herpes zoster also damages which sensory nerve? Sensory nerves, especially sensory nerves, especially dorsal root ganglion on the cranial nerve ganglion or cranial nerve ganglion where the bacillus zoster virus VZV reactivates. Okay. So we know that treatment is acyclovir or valacyclovir, and it is a painful condition, herpes zoster, and it is a midline demarcation on the back of the patient. So this question is over. I hope you will get good information. Come to the question number 5. Question number 5. A patient who has anticonvulsant medication presented with rashes, which is shown in the following image. What could be the diagnosis of this patient? Option A is urticaria. Option B is fixed drug eruptions. Option C is angioedema. Option D is cellulitis. Already this patient is taking medication. He is taking some medicine, some pills or capsule or tablets, that is anticonvulsant medication. Okay. Because of that, he is getting rashes on his body. So which type of rashes is this? First is urticaria, second is B, fixed drug eruptions, C is angioedema, and cellulitis. And he is a patient already taking anticonvulsant medication. So our main aim should be any type of reaction, that is fixed drug eruptions because of medication, side effect of medication. See this image, very spotted image in the dark. Okay, so this fixed drug eruptions, yes. Come to the question number 6. Question number 6. Identify the image given below. This image of dermatology. Option A is carbuncle. Option B is follicular abscess. Option C is cellulitis. Option D is erypselas. So which is the correct option? Please tell me. Think about it and tell me what is the correct option of this question. Carbuncle, follicular abscess, cellulitis, erypselas. Yes. Option among all these 4 options, option A is the correct, that is carbuncle. See, the image P-U-N, carbuncle. Let me make it clear. Carbuncle. Yes. See, carbuncle. Carbuncle. Okay. There is a question, fill in the blanks. This question, dash appears as a single large indurated erythematous nodule with dash draining pustules, sinus tracts on the surface formed by coalesced furuncles from dash infecting contiguous hair follicles and subcutaneous tissue. Systemic symptoms are. What are the symptoms of this question? Again, the carbuncle, this is our answer also. C-A-R, car, remember it, B-U-N-C-L-E, carbuncle. Appears as a single large indurated erythematous nodule with multiple draining pustule sinus tracts on the surface formed by coalesced furuncles from S. aureus. S. aureus. Staphylococcus aureus is the causative agent of this carbuncle. What is the systemic symptoms? Systemic symptoms of this person? He will have fever. He will have F-E-V-E-R. He will have fever and malaise. He will feel something tired or like this. Okay. Malaise also. This is a table. Key features. I have written here the key features, options, and key features of the option. Why? Carbuncle. Multiple pus heads are there, and all this will be the deeper side, tender mass. Okay. What is carbuncle? C-A-R-B-U-N-C-L-E, carbuncle. Okay. And this is our answer also. Single superficial pustule at the follicle. Option B, that is follicular abscess. This is not our answer even though, but you should know the definition. Maybe same question will not come in the exam. Diffuse brownie, indurated edema, no pus heads. So option C is cellulitis. What is the definition of cellulitis? Cellulitis, okay? Cellulitis. The definition of cellulitis is diffuse brownie, indurated edema, no pus heads. Option D, superficial raised serpiginous border. Option D is Erepsilase. Erepsilase. Okay. Option D is Erepsilase. Okay. We finished question 6. Question 7 is very easy. I hope you know about it. Question 7 is very easy. This image has been given here. Hypopigmented rash. It means there is a pigmentation problem in the patient. Hypopigmentation, and also there is a key point. Another key point is satellite lesion. Okay, so 2 key points. One key point in this question is hypopigmented rash. Another is the satellite lesions present on the back of this patient, and third key point is that the question has given the image. So we have 3 key points to find out the answer. So what is the answer? I will tell you later. First of all, come for the explanation. Okay. This is all about the explanation, leprosy type and skin lesion. Borderline tuberculosis, borderline tuberculoid. Okay, that is BT. What is BT? What is BT? Borderline tuberculoid, large plaques, satellite lesions. Yes, there is a satellite lesion in this definition. And finger-like projections, that is pseudopodia. Option B, that is borderline lepromatous. What is the definition of borderline lepromatous? Numerous ill-defined macules. Ill-defined. It means that the border is not clearly defined. It's rough border, okay? Undemarcated border. Plaques and here is symmetric. So that is borderline lepromatous. The abbreviation is BL. BL. Short form is BL. Here is a lepromatous. Option C is lepromatous. Symmetric papules. This is symmetric. Nodules, plaques, and leonine face. Okay. So this is lepromatous. LL. And last one is tuberculoid. A few hypopigmented anesthetic macules, plaques, sharp borders. So this is tuberculoid. TT. Tuberculoid. We can say TT. Yes, TT. So come to the question again and tell me the answer. Oh, I have explained the question. There is a hypopigmented rash with satellite lesions. So satellite lesion was present in my definition. Okay. The definition A, present on the back of the patient, this patient. So option A is the answer. Okay. Option A is the answer. The best answer is option A because hypopigmented rash and satellite lesions are present in the definition of borderline tuberculoid. Okay. So this is our option. Why option A? So I have given the reason. Come to the question number 8. This is very important question. Every year we have, most of the time MCI asks this question, FMGE exam. A person has chronic alcoholism. He is a very much drinker, drinks too much alcohol. Okay. Which deficiency causes the following disease shown in the image? Okay. So there is a necklace type pattern below the neck. Okay. Necklace type pattern below the neck. This is very, very famous question for MCI, necklace, and we say castle neck. CASL. Castle neck appearance. Okay. Castle neck appearance. Necklace. Necklace. Just like a necklace appearance. Okay. Which vitamin? This is because of not riboflavin, not ascorbic acid, not biotin. This is because of niacin, because of D, option D. Okay, this is very favorite question of MCI. I think most of the time they ask this question in a different form. Sometimes they will give the image, ask something. Sometimes they will not give the image. Again, they will ask the vitamin. Okay, which vitamin? So you have to understand and write the answer. The patient has had dermatitis diarrhea for 2 months. It was also mentioned before, dermatitis diarrhea or something, and the patient has appearance of the castle neck. So we conclude that it is also a kind of also in this case sometimes death happened. Vitamin B3. This is because of vitamin B3. Okay, forget the pellagra or something. There is too much deep information for pellagra. This is because of vitamin B3, that is known as niacin. Come to the question 9. Very easy and very good, very interesting question, very familiar question. Question this: the disease is caused by deficiency of which vitamin? I already told you. If they will ask the vitamin, then you have to write vitamin B3. Okay. Okay. Question 9 now. Identify the following image. Here is the image. See the leg of this female. That's very big. One leg is very big, very fatty leg. So what is the answer? Varicose vulgaris, elephantiasis, leprosy, and leishmaniasis. Of course, this is elephantiasis. This is a very basic question. It's not so tough. So you can find it from the image also. Elephantiasis. And what is the elephantiasis? Wait. We can see unilateral swelling. Yes, swelling in the one leg. That is why it's a unilateral swelling. Unilateral swelling in the lower limb. In the elephantiasis, there will be a chronic lymphatic obstruction. Why it happens elephantiasis? Because there is a problem in the lymphatic system of this woman, transmitted by culex. Okay. Once the microfilaria enters the body, they convert into adult form and they finally destruct the lymphatic system of the human beings or this lady, causing unilateral or non-pitting edema of the lower limb. The skin changes, hypertrophy, varicose changes, and pigmentary changes also can be seen. But you can find the answer also by seeing the image also. Okay, so this is not so difficult question. One question, this was a very famous question for MCI, truck driver. They will also mention truck driver, always mention truck driver or taxi driver. A truck driver with history of lesions on the penis undergoing treatment is having some lesions on the penis undergoing some treatment, presented with rashes, and there is a rashes are present over there at the site of the penis, maybe in the glands or maybe on the foreskin. What is the diagnosis? Secondary syphilis, drug eruption, stain, or Steven-Johnson syndrome? So the answer is very easy because this patient is have syphilis, STD. Okay. See, according to this picture and image, see rash on the hand and palm on the back of this patient, this truck driver. Okay. Come to the explanation and key feature of few additional information. Caused by hematogenous spread. This syphilis is caused by which spread? How it spreads? Hematogenous. And causative agent is Treponema pallidum. Okay. So this is secondary syphilis, SS. Okay, secondary syphilis. Variable morphology, often pruritic, and drug history in this patient. What is this? Is drug eruption. This is option B, drug eruption. This is not our option answer. Eruption. I'm telling to you why drug eruption is not answered in this question. Full thickness necrosis, greater than 30% body surface area, mucosal erosions, and Mikulski sign is positive. So what is our option C is 10. Why it is not answer? Because it's not related to our question also. Body surface area, they are talking about body surface area greater than 30%, which is not mentioned in our question also. Our question mentioned about the truck driver and have this skin rashes. Okay, so less than 10% body surface area and target lesions and prodrome. Our option was SJS. Okay, SJS. What was SJS? Option D, Steven Johnson syndrome. SJS, Steven Johnson syndrome. You can see in the question, is written in the question. Okay. So this is all about today. We have finished 10 questions. Thank you very much. Hope you like the session. If you like it, revise it again. If you don't like, ignore it. Okay. I hope you will get benefit. Thank you very much. We are finishing the class. Thank you.